started with the session today on disability disclosure and equity in residency. I know eras are coming up for everyone, and even if you're not applying to residency right now, this is an important talk at any stage of medical training, so thank you guys for coming. And I'd like to introduce Dr. Stephanie Moss. She's a PGY2 psychiatry resident at Rosalind Franklin, and she's here to share her story. We'll also be having a short video from Doctora Flores, a faculty advisor at Ultimate. So we'll get started.
Hello everyone, I'm going to start with disclosures first. I am presenting today in the city of Chicago, which is located on various ancestral lands that include the councilman of the Three Fires, and multiple ancestral lands of indigenous nations. I'm also going to be sharing my personal, everything I say is from my own personal experience being a Latinx, female, heterosexual individual with endometriosis, PTSD, generalized anxiety disorder, and interstitial cystitis. So today we're going to be talking about the definition of what is a disability, then talking about disability in medicine, my individual journey, and how I went through disclosure over my medical school career, the pros and cons of whether or not to disclose, how to disclose in Residency App. This is the same if you're a pre-med going into medical school. This is also similar. It is both work, whether you're applying to residency or applying to medical school. We're going to talk about protections, finding a disability-friendly program, residency or medical school, why we need disability in medicine, and open it up at the end for question and answer. So what is a disability? So there are I've shared two definitions. One by the ADA, which is the American Disability Association, ADA. So an individual with a disability is defined as a person who has physical or mental impairment that sustainably limits one or more major life activities, a person who has a history or a record of such impairment, or a person who is perceived by others as having some form of impairment. That's their official definition. I have my own. It's a physical or mental health condition which limits your ability to do your best in academics, work, school, relationships, or just life in general. So let's talk about disability in medicine. Now, I love this. This is from the most recent, so people who just graduated medical school this year. When you're about to graduate, you fill out a questionnaire. It's a long questionnaire, and one of the questions is asking about, do you have a disability? Look at how it's increased over the years. More and more people are coming into medical school or learning that they have a disability. It's gone up to over 12.7%. And let's look at the types of things that people are disclosing, or at least they're noticing. ADHD, chronic health disability, deaf or hard of hearing, learning disability, mobility disability, psychological disability, visual disability, or another one. 2,141 people. Can you believe it? That's amazing. If you have done a leave of absence or know someone who has done a leave of absence, please share this QR code. I'm going to share the results of our own research that my medical schools and I created because I had a leave of absence during medical school to focus on my own health conditions and also step one. This is so meaningful to me. This is the percent of students who say that they're underrepresented in medicine, whether by race, first generation, disability. I can't see the percentage, but here it is. 80% of people who are taking a leave of absence say that they're underrepresented in medicine. 80%. And because we're an LMSA, Latino Medical Student Association, I like to say 48% of people who did this survey said they identify as Hispanic or Latinx. Those are the individuals taking a leave of absence. Love this quote by Brené Brown. There is power in being vulnerable. This is one of the guiding principles I had during medical school to help me with my personal disclosure in medicine. My own journey. So this is a view a little bit of what happened during medical school. I'm originally from Colorado. We're in the Colorado room, so that was perfect. My husband and I both went to medical school together. We both went to Rush University. Then COVID hit in March Second year, I had my sex and reproductive block. All the symptoms in my sex and repro block, I felt that I had these. And this was more than hypochondriac, and I definitely was called that, of medical school anxiety. But then I started to find, no, there's actually all these symptoms that I had growing up were actually a health condition. Eventually I was diagnosed with endometriosis. During all that stress of COVID, trying to get a diagnosis, I struggled to pass step 1, which I know is already hard enough to pass step 1 when you're in medical school. So add in those additional stressors. So I took a leave of absence. I ended up failing step twice until my best friend in medical school. She had ADHD and she had been with me so close during my own health condition journey. And she was like, wait a minute, you just got diagnosed with health conditions. Did you know that's a disability and you qualify for accommodations? I was like, whoa, what? But I've never had accommodations before. I don't identify with disabilities. I had a picture in my mind of maybe it means a wheelchair. I'm not in a wheelchair, I must not have disabilities. So it took me time to be okay with just getting over that emotional, okay, maybe I do have an identity of taking on this identity of disabilities, and maybe I do deserve help. And that's what I'm trying to tell you. If you have a health condition, visible or invisible, you deserve support and help. I ended up getting accommodations, double time, came back in 3-year and 4-year, and then I dual applied family and psychiatry. And then I ended up disclosing in my application. So we'll talk about that today. I started off by just sharing it with my classmates, a group of like 20 people. We were having a talk about ACEs, adverse childhood experiences, and I started to realize, I experienced this too. What happens if I disclose? It's a small group, we've been with each other for over a year, let's see what happens. And I was so impressed by the amount of love and support and questions they had, and people that started saying, wait, I want to talk about this too. I have this experience too. So that was small, and it just kept getting bigger and bigger as I learned and felt more safe to disclose to my entire medical school class, the rest of the medical school, and then eventually to social media, writing articles to make it public, eventually landing to creating my own podcast, which is called Life as a Patient Doctor, sharing my journey and sharing other individuals in medicine who also have a disability or a struggle in medicine. So courage is contagious. That's exactly what I noticed. As once I was willing to share my story, other people wanted to share theirs too. Okay, now let's talk about real deal. Let's talk about what to consider. This is a common thing I went through, and a lot of people ask me about. Pros and cons. Pros, I'm being authentic. Cons, there's a social stigma. I can't change that just by wishing. Pro, I might gain opportunities. As a diverse member, I was invited to write articles for MedPage Today, Proximity, all these different things because I was willing to share. Con, I also lost opportunities. I did not get any awards on my graduation in medical school that normally I would have hoped I would have been able to receive, but because of my disclosures, my school wasn't that happy about it. Let's just stick to that. By some people, it's seen as resilient, but some people it's seen as weak and vulnerable and just inadequate and not what a doctor is. Inspire others, but can also experience emotional trauma. I'm not gonna lie, it's hard. It's hard to be in an area where people don't believe you, and every single time I take a step and do it, I risk that situation. Pro, I might be able to do better in school and get the resources I need. I'm about to take step 3 again, and I get to do step 3 over 4 days instead of 2 days. That was the help that I needed to feel complete, to feel awake during those long exams and do my very best. Cons, professionalism, right up. My article on their doximity on professionalism. Definitely got multiple of those at my school. Okay, Doctora Flores. And you are not Doctora Flores.
Yes, I am not. I'm Sarah. I'm the medical student who has worked closely with Doctora Flores. I'll give you a short background because I know time is a thing. But Doctora Flores, like I mentioned earlier, she's the faculty at Med's Family Medicine program. She also served as an epidemiologist and an assistant researcher at the Department of Epidemiology at UCLA. She uses a manual wheelchair and hearing aids. She has a genetic disability called Charcot-Marie-Tooth. She openly shares about how she has struggled with that throughout medical training, most specifically in medical school. I'll let her take it away as far as what her experience is as someone who has a visible disability. What was your approach in your disclosure in both, I guess, your medical school applications and your ERAS applications? And did that come up first thing in interviews, or is that something that you discussed in your personal statement?
Yeah, so my wheelchair is really obvious. I couldn't hide it if I wanted to. And not all disabilities are like that. So I was very open about it. And I felt like if a school or a program was going to take me, they had to take all of me, right? One of the reasons I really wanted to become a physician is because of my experience as a patient with a disability. So, yeah, I was honest about it in my personal statement, both for medical school and in residency. It also taught me how to be really creative in difficult situations, which is a much needed skill in medicine. So, yes, I did write about it. And I think that actually helped me, especially in residency, get into a program that was really supportive.
Great. How did programs respond to your story, and both during the interviews and in your follow-up communications? Were there any standout positive or negative interactions that you had on your interview journey?
For medical school, I didn't get invited for an interview everywhere. But the places that I did, I would talk about it. For residency, I actually had a little bit more, I guess, confidence to say, like, hey, obviously I'm sitting in this wheelchair, but I've managed medical school, just fine. I know that there may be some challenges, going into residency, but this is how I'm prepared to deal with them. I was looking for residency programs that were big, so I wasn't like one of just a few residents, there would be a lot of us, and B, in like metropolitan areas that would be accessible. I brought it up when I needed to, but ultimately it came down to planning once I matched and got into a program. For the program, I ended up going to Montefiore Medical Center in the Bronx. It's the residency program in social medicine. They were awesome. They reached out to me. Like, I got a call on match day, like, hey, we're so happy you're coming. Messages from the program director so that we could start planning ahead of time and not wait till the last minute.
Was there anything that the program had in place in processes they've done for other residents who had similar disabilities, or maybe they just had that system in place? Or was that something that you felt that you had to educate them on as things cropped up?
I don't think they had someone in a wheelchair before. And then I also use hearing aids, so that's challenging. But I felt very welcome to be able to educate them and tell them what I needed. Mm-hmm. And I just had really good support from my co-residents. But I do remember that there was something specific in place. But whatever I needed, we figured it out some way.
Okay, great. A doctor with disability, and for all the students in the room who are potentially thinking of applying to residencies and are not sure about how to go about picking programs or what criteria they should use when selecting these kinds of programs, what advice do you have for any applicants who are navigating ERAs with visible or invisible disabilities, especially around being honest and advocating for themselves and finding those supportive programs?
That's a really good question. So disclosure is a very big thing. Not all disabilities are visible, and it can be really hard to have to disclose what disability you have to someone. And then, there's the phases. So like you're applying and then you want to get in, and then once you get in. But remember that there are laws to protect. I would go to a program where you mesh well with the people and maybe ask or look on the website, like what do they do to support residents with disabilities? Because I can tell you from experience, it can be done. It can be done, right? And so I don't think you have to disclose a disability. I honestly don't. I think that's a personal choice. That's up to you. But know that unfortunately in medicine, the way the culture is, you may have challenges if you end up somewhere that either doesn't have experience with it or they're not open to helping you. Because I can tell you, like in medical school, when I had pushback from one of the deans when I was going into third year, I actually had to get a lawyer. I had to get a disability rights lawyer. Also, like to get accommodations, even on my step exams from the NBME. I had to fight and appeal and get a lawyer to help me with that. With or without a disability, the best advice I can give you about residency, because it's hard no matter where you go to a place where the people are like-minded, the people care about the things that you care about, and their mission is in line with what you want to do as a doctor.
Thank you for that. And I feel like that's a great place to end. Is there any last messages or takeaways you'd want to share with any medical school students about disability inclusion in medicine as a final little send-off?
So what I want to say is that we need you in medicine. We do. And, in my story, it was always like, oh, disability, you have to fix it or accommodate it, or, are you going to be a risk to patients? Can you do this? Technical standards, blah, blah, blah. No one ever in my entire journey thought that my disability could actually enhance my ability to be a good physician. So we need you in medicine. We need your expertise. You are talented. You are worthy. Don't let anyone tell you otherwise. There are ways around doing things like technical standard. And so don't let people tell you otherwise, because we need you. We need you in medicine. We do. And the patients, I can tell you now as an attending, appreciate that, like, my tables are height adjustable tables. So, making an accommodation for me to help to be able to see my patients actually helps future patients with disabilities have accessibility when they come to the exam room, right? And you definitely have a perspective that not all medical students have, that we need in medicine. We need to make it better.
Thank you, Doctora. Doctora Flores, let's talk about disclosure in residency applications or medical school applications. I'm a PGY2, so more recently I'm closer to ERAS, so I'm going to talk more specifically about applying to residency, but I do want to say, if you're pre-med, this is similar. I recommend that there are really 3 locations where you can think about or disclose. One is the meaningful experience, one in the areas under academic failure or leave, and then third under meaningful activities. And I'm going to pause, and the reason I say this is because this part of the ERAS, usually the only person who read it is the program director and associate program director. They have thousands of applications, attendings, residents. The people who are reviewing the applications do not have time to read this section, so this is more private. This is why I recommend when people ask me this question. Personal statements. This is a hard one. Let's talk about pros and cons, because this is what I had to go through. And when I meet with medical students and pre-meds, this is also what I go through with them. Okay, pros. A lot of times, our disability is the reason we're in medicine to begin with. So it does share what led you to become where you are today. It's very possible it can help invite you to an interview. If someone reads your application who agrees and is empowered by your statement and by disabilities, if they are a program like that, you will most likely be invited. The cons can be the opposite. There's still the social stigma, especially in medicine. So it can open it to prejudice and ableism. The biggest thing I share with applicants is your disability who you are? Is it all of you who you are? If it is, okay, then go ahead. But I think it's more. I think it's just one aspect and one part of your identity, and especially when we're talking about applying to residency, you're applying for a job, to be a doctor. So think of it in that way, and I think that helped me think about what qualities or stories in my life lead me to be a good doctor. And so that's a little bit more, hopefully that helps. The concept of need to know. To the people reading your application, you really need to know. Maybe not. Always think, no matter if it's a patient and whether if it's the application, how much or how little do they actually need to know? All you could say is, I have a health condition, I have disabilities. That's it. Okay, so these are the common questions I receive. Will they see if I received accommodations in med school? No, 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 they will not. Unless the school discloses, but then that is against the ADA because they are disclosing your disability. Only you have the power to disclose. Will they see that I got accommodations for separate complex or MCAT? No, they will not. All they see is a score that is against ADA. Yeah, they're not allowed to disclose, that's the thing. Regarding can I disclose only some programs specifically, what I invite you to think about when I get this question, you can either write one personal statement, like separate and do one personal statement for that program, but it takes a lot of time. If you know there's a program director or a program that's really into disabilities, but not other ones, you can write a separate personal statement and assign it to that program. So that is one way. Another way that I recommend is just email them. After you submit your applications, you're going to go through and email your top programs. So that is also an appropriate place because you email directly the program director. Yes, you can disclose after interviews. You can disclose before you get a promotion, during, after, whenever, or never. Okay, so let's talk about you got an interview. That's amazing. Now, I did not disclose until maybe halfway through. So I went through multiple interviews where I did not get there. They didn't ask me about step failure, or if they did, I had another story that did not involve disabilities. But when I felt I was safe and ready, this is how I did it. I only did it to the program director, and that was helpful because I did it in a way to say, what type of resources exist? Or how have you helped other residents that need additional support? Or if one of your residents is really struggling emotionally, what resources do they have? Or just struggling in general? Give me an example. If my residents don't struggle, I don't know if you should go to that program because we all struggle. You can also wait till post-match day and go directly to HR and directly to the program director to ask for accommodations. That's always an option and a good option too. So I said this before, focus disclosure. Ask yourself, what is the purpose? Why am I disclosing? Am I disclosing because I just feel like I need to get off my chest? Maybe that's not the right reason. Is it to help me feel better? Or my patient or the other person feel better? Am I acknowledging or just trying to use it as an excuse or explaining? And then will this harm our professional relationship in any way? This is more important when we're talking about disclosure to patients. And I do disclose to patients, not all of them, not even close to all of them. It has to do with the patient that I have a similar health condition and maybe they're struggling, particularly when they struggle that they don't believe that anyone else could ever struggle like them, or they can't ever be successful or do anything with their life. That's when I say, I have a disability too, or I take meds too. I became a doctor. That always empowers them. I always have a reason for it, and reason for them and not for me. Next slide, please. What laws and protections are there for us? So, the ADA prohibits employees from asking questions, and not just the ADA, it's actually part of the body that does the ERAS and the residency applications. They're not allowed to ask any questions about race, identity, disabilities, marital status, child, like having a child or not. So there are protections. And I'd like to say that because if they do, there is a place to anonymously report them. These are red flags. These are the questions they're not allowed to ask. They cannot ask you, do you have a disability? They cannot ask you, do you have X health condition? Have you gotten accommodations? All those things. No, they cannot ask you that. And if they do, because I have had people tell me that they do, you can say, I'm not comfortable answering that question. I would love to talk to you about this instead. I remember I had an interview with a program I will not name that didn't realize it was personal, but it definitely was borderline, where I cried significantly after. How I spun it is when they told me that, I won't say what it was, but what I did is like, actually I would like to tell you about this experience and how meaningful it was. I had to do something during COVID. I'm like, I would love to talk about my experience with COVID and helping the homeless population. Then I went into that. So have these stories pre-made for a situation where they ask you something inappropriate or they ask you something that emotionally triggers. Just be ready, like, I'm gonna give this story. A disability-friendly program. So things that don't even mention disability, but are really good things to think about. Flexible scheduling, I can't emphasize this enough, particularly regarding if you're sick, what does it look like? Who covers you? Are there co-residents who cover for you? And then put in more work for them and maybe could make them not as happy. Do attendings step in? Is it okay and nothing happens? So asking these things, these are all great questions to ask the residents or the medical students when you're doing those happy hour side things, or emailing them, sending them a message on social media. These are all great things to ask. Having free counseling, asking if any of the residents have partners or families, shows that they value it. When you receive your contract after match day, if you haven't disclosed at that point, you just turn, you see a whole section on resources and disabilities. You got lucky. I know that because my program does that. They have an entire section on disabilities and resources, so I was very thankful. My program is Rosalind Franklin University if you're interested in psychiatry or internal medicine. And as little 24 shifts or none as possible. A lot of people ask me what specialties are more disability friendly. Today in 2025, surgery residencies are in general, any surgical specialty is unfortunately still on that stigma. Unfortunately, those are considered more on the not as disability friendly because they're more harder work hours. They, no matter what, always hit the 80+ hours per week. And then ones that do more outpatient work, you want to look for a program or a specialty that's more humanistic, sees their patients as a whole. I know individuals that are in those specialties and it is part of their specialty, is really seeing people as a whole. Why we need you in medicine. Let's talk about the benefits. We talked a lot about talking about us. Let's talk about the reason we all went into medicine. Patients. Our patients naturally see us as leaders. Breaking that barrier and showing the humanity in us can help patients feel more trusting, more willing to follow our advice and suggestions. It can strengthen the communication between, I guess a good example is I had a patient with endometriosis. I was in a pain clinic and she was so hesitant because a lot of the doctors didn't believe her and her pain. And when I said, no, I get it, I have endo too, she was like, oh, thank you. She no longer had to justify her pain or why she needed support for coming to our clinic. Breaking down that stereotype of doctors being superhuman. We're just human. And the unsaid idea of I get it. Now what's the benefit to medicine? Medical school, medical education as a whole, by having more people going into medicine, with disabilities, we're normalizing it. We're helping combat that stigma. We're teaching our co-workers, our co-residents, our attendings that it is possible to have disabilities and be a doctor. They are not separate things. Okay. Ooh, we did well. Okay, some takeaways. We've talked a lot about disclosure. I'm going to say disclosure is a personal choice. I don't want you to think that I did this presentation to say this is why you need to disclose. That was not the point. My point was to say that you are not alone. I'm one of you too. I struggled. I got accommodations. I struggled with a lot of the things that we're scared about, of getting professionalism, almost getting kicked out of medical school. But I still was able to get it. So you can do it too. You can still make it. We talked about the pros and cons of whether to disclose and where to disclose. Talked about laws, making sure medical schools and residencies cannot ask you things about, because that is an identity question. If you decide to disclose, keep it as specific as possible. Just drop it. I have a disability. I have a health condition. I have a mental health condition. That's it. You don't need to know anything else. If you want to be specific, that is fine. But you don't need to go through the entire story or every side effect. You're not justifying your health condition. You're not justifying yourself to them. You're saying you are an applicant and be a great resident doctor at their program. You are needed in medicine. No matter what happens, no matter what challenges, no matter what things people throw at us, do not give up. If you're nervous about applying to accommodations, just try it. Even if they say no, at least you tried and you advocated for yourself and your needs. Some resources that I like to share. MSDCI is the Medical Student Disability Group.
Chronic illness.
Thank you. Chronic illness. Ask Jan. I actually recommend this one to my patients a lot because you can actually go in to a specific mental or physical health condition and look at the example accommodations you can ask for. I know, especially for me that did not have accommodations ever before, I didn't even know what to ask. And I feel like that's a common thing. We're like, I need help, but I don't know what to ask. Ask Jan really helped go through different examples. You might find something that you didn't even know you need. And it's flexible. Once you ask for accommodations in your residency or in your medical school, you can always not use them. It's better to ask for more and then balance. This is my personal website that I have. I have specifically a section on disabilities resources, and I do share different blog posts depending on where you're at, how to apply for accommodations in the school, what happens if you fail, what happens if you considering taking a leave of absence, so check that out. And then I put this in some places. This is a QR code that goes directly to my LinkedIn, which has a lot of the resources that I mentioned today, including my podcast and different blog posts that are most popular with individuals who request resources, so I hope they help you. Thank you so much for coming, and I will open up for questions.